Hi everybody. We are so elated to meet you in the program of Tea Kadai Bench. Good morning, sir. Sir, 43 years old male patient came with a history of extreme tiredness with muscle pain.
Okay.
As usual, he voluntarily did the master health checkup. Everything came as a normal except the vitamin D3 level.
Okay.
So somewhat it around 10.
Okay.
So what is the cause for the sir? And nowadays, most of the patients came with a history of vitamin D deficiency.
True.
So what are all the causes, sir?
So vitamin D deficiency, I think that is very, very common nowadays because one literature says that in India, 60 to 80% of the people present with vitamin D3 deficiency, very common. Probably, I think that lack of sun exposure. Because another important thing is vitamin D3 is present only in non-vegetarian, especially in the fish. So those who take vegetarian, so they really, they are deprived of vitamin D. So that important cause also to be thought of. So vitamin D3 is quite common, so we can't deny it.
Okay, sir. Then apart from bone, normally we are everybody aware about that vitamin D3 is related to bone.
Yeah.
So if it is deficient means the patient or public, everybody knows is the bone related issue.
True.
So is there any other factors or any other function apart from bone, sir?
Actually, vitamin D is causally and in fact it is very much associated with bone disease. But there is some kind of conflict association between vitamin D deficiency and the onset of cardiovascular disease and immunological functions. Even they say onset of diabetes, even depression and lack of sleep. To some extent they say cancer, but it has not been proven actually very clearly. Actually, one vital study clearly demonstrated that replacement of vitamin D didn't result in reduction of cardiovascular events basically. So there is some kind of association between vitamin D deficiency and the problems what I have mentioned just before. But the most important proven one is vitamin D deficiency and the, of course, rickets in children and osteomalacia in adult and osteoporosis, of course.
So what are the sources of vitamin D3, sir?
Actually, vitamin D3, our body receives vitamin D3 from three main sources. One, the most important is sun exposure. They say that 40% of our total body skin should be exposed to the skin. So when UV rays of the sunlight, falls on our skin, what happens? 7-dehydrocholesterol that is present in the skin is converted into vitamin D3. So that is the first step, vitamin D3. But what you have to remember that you require 125 hydroxy vitamin D3, which is considered as the active form. So what you are getting from the sunlight is nothing but it is just vitamin D3. So this vitamin D3 should be converted into active form. So if you want that active form from the product that is derived from the sun exposure, you require two important intact organs. One is liver and second one is the kidney. So what happens once vitamin D3 that is derived from the skin exposure, that is going to two important areas. One, to adipose tissue where it is stored. Then one part of vitamin D3 that is derived from the skin exposure goes to liver where it is hydroxylated. So the process of hydroxylation occurs in the liver. So what happened? Now this vitamin 23 is converted into 25 hydroxy vitamin D3. This is not sufficient. This 25 hydroxy vitamin D3 should be converted into 125 hydroxy vitamin D3, which is considered as an active form, which is the one that is responsible for absorption of calcium and phosphorus from the intestine and absorption of calcium from the, from the kidneys as well. It is the form that inhibits the bone resorption. This is the active form that is responsible for promotion of the bone formation. So what you have to what you have to remind that there's a three process. From the skin you are getting one product, that product should be hydroxylated at the liver, then that in turn that product should undergoes one more hydroxylation in the kidney. So you require 3 important organs, I could say. You need your 40% of skin of your total body should be exposed to the light, and you should have intact liver, and you should have intact kidney function, renal function. So this is the way vitamin D is prepared.
So we can enumerate the causes depending upon the sources also.
Yeah, probably. See, when you are not exposed to the skin adequately, there is a lack of skin exposure, one cause. When you harbor active liver disease, then probably vitamin D deficiency occurs. When you have chronic kidney disease, of course, you don't have any active form at all. These are the 3 causes. And the food sources also, we have to be mindful. The problem with the food sources, vitamin D is not prevalent in each and every food. That is the biggest problem. They say that only fishes, especially fatty fishes, they say salmon, and there is a mackerel. Mackerel in Tamil they say Kananguluthi mean. Then sardine, that is called matti mean and sale mean. So I think that is least, that is most ignored, I could say. So we prefer the kingfish, something more than that. But what you have to remember that this fatty fish, that is so called salamine, that contains good amount of vitamin D. If you consume just 100 gram of these fishes, that can offer 50% of your daily, daily requirement of vitamin D3. That you should be mindful too.
So for the patients, whoever have their liver disease or kidney failure or inadequate exposure, we can replace it through some tablet forms.
Yeah, some tablet form. Yeah, that's true. So for example, they say when you have liver disease, then you can give 25 hydroxy vitamin D3. That is called calcitonin. Then in chronic kidney disease, lifelong. See, once liver disease is not reversible means it's lifelong. Like in CKD, all the nephrologists, they used to give 125 hydroxy vitamin D3. So the reason, see, when you look at the treatment chart of CKD, apart from the correction of anemia, so this 125 hydroxy vitamin D3 is part and parcel of CKD treatment. And another important is, see, suppose if somebody is vegetarian, okay, vegan. So at that time what happened, they cannot take fish and they don't have adequate sun exposure. Some of the diets that is fortified, so artificially fortified with the diet. So for example, in the orange juice, the vitamin D3 is fortified, in the oat milk and almond milk. So I think that it's commercially available where these vegetarians can largely rely on that. Or I think that if they have very low level, then they should be forced to take daily vitamin D3 1000 international unit or 2000 international unit per day, especially in high risk group like postmenopausal osteoporosis and those.
So what is the expected level, sir, of vitamin D3?
Actually, vitamin D3 expected level is 40 to 60 nanogram per ml. Okay, but what you have to remember that anything less than 12 nanogram per ml, then we consider that is vitamin D deficiency. Okay, they say between 12 to 30 vitamin D insufficiency. But what is prudent that you have to maintain at least vitamin D3 above 30. So that is very, very important. But the very good level, we could say between 40 to 60. So you have to better to reach than 40 to 60. Until then, I think that better to be supplemented or better to be exposed to the skin or whatever way, the food sources. But the value, what we expect is between 40 to 60.
So we have to maintain above a level of 40 to 50.
40 to 60.
40
yeah, we
to
can
60.
maintain 40 to 60
sir,
basically.
Okay.
But generally, if it is below 12 nanogram per ml, generally apart from replacement like 60,000 international unit, okay, weekly once, and then we can supplement with them 1000 or 2000 international unit for a day for a couple of months also. Those who have severe deficiency, that also we have to be mindful.
Okay. So routinely we are giving the vitamin D3, it should be hydroxylated. Okay, sir?
Yeah, true. Definitely it should be. So whatever we give that commercial preparation of vitamin D3, that should be hydroxylated at liver once, then it should be hydroxylated at kidney successively. So then only you will get the active form. Okay. So those who have been harboring kidney and liver disease, you can't give simple vitamin D3. That's why I am trying to insist. If they have kidney disease, then you have to give 125 hydroxy vitamin D3. Whatever the available vitamin D3, what we give very simply is simple vitamin D3 that should undergo hydroxylation at liver and as well as the kidney. If they have kidney disease, then you have separate preparation is there. That is called 125 hydroxy vitamin D3 that you can give.
Thank you so much, sir. You were explained so well about the function of vitamin D as well as about the sources in detailed manner, how we are getting and good sources for even vegetarians also you have already mentioned in various ways. And at the same time you said about the role of liver as well as the kidney, the two major vital organs which have the role in vitamin D3 hydroxylation as well as various more functions, bone resorption as well as calcium and phosphorus absorption from the intestine. Everything we understood very clearly. Thank you so much, sir.
Thank you.